Hi friends, welcome to my YouTube channel. This is my YouTube channel only mean for staff nurse previous questions. So we have discussed Sri Chitra 2015 question papers, two parts before. This is the third part. So we will see next question. Mr. D is admitted with multiple traumas. He requires rapid blood transfusion of several units of blood. The most essential device required to prevent cardiac arrhythmia is options A. Pulse oximetry, B. Cardiac monitor, C. Infusion controller, D. Blood warming device. The correct answer is option D, that is blood warming device. Question number 52. Patient needs 30 milliequivalent of potassium chloride added in 500 ml of normal saline to be administered over 10 hours. The drug is available as 40 milliequivalent in 20 ml ampule. How will the nurse prepare the drug? Options are 30 ml potassium chloride in 500 ml normal saline, 12 ml potassium chloride in 500 ml normal saline, 14 ml potassium chloride in 500 ml normal saline, 15 ml potassium chloride in 500 ml normal saline. The correct answer is option D, that is 15 ml potassium chloride in 500 ml normal saline. Question number 53. Physician prescribed 1000 ml normal saline to infuse over 8 hours. The nurse sets the flow rate at, the given options are 40 drops per minute, 28 drops per minute, 31 drops per minute, 36 drops per minute. The correct answer is option C, that is 31 drops per minute. Next question. Physician's prescription reads levothyroxine 150 mcg daily orally. The drug is available as 0.1 mg tablet. How many tablets are required daily? The options are 2 tablets, 1.5 tablets, 1 tablets, 3 tablets. The correct answer is option B, that is 1.5 tablets. Question number 55. Mr. P's surgery is postponed after seeing the blood report. Which of the following report is abnormal? Options are HB 11.9, serum sodium 140, platelet 2,10,000, serum creatinine 3 mg. The correct answer is option D, that is serum creatinine 3 mg. Next question. While inspecting the abdominal surgical wound, nurse noticed wound evisceration. The immediate steps in nursing management include all except options are provide pressure dressing, B. Prepare for wound closure, C. Inform the surgeon, D. Make the patient lie down in supine position. The correct answer is option A, that is provide pressure dressing. Question number 57. The nurse has to instruct the patient to withhold a prescribed dose of tab digoxin if the patient experiences option arthralgia, chest pain, blurred vision, increased urinary output. The correct answer is option C, blurred vision. 58. If a child develops tonic-clonic seizure, the most appropriate action expected from the nurse is to options are insert airway, administer oxygen by mask, use a paddled tongue blade, position the child laterally head down. Correct answer is option D. Position the child laterally head down. Question number 59. The platelet count of a 4-year-old child suffering from leukemia on chemotherapy is 29,500 cells. Based on the lab report, which intervention the nurse will document to include in the nursing care plan? Given options: monitor closely the signs of infection, Monitor temperature 4th hourly. Isolate the child to protect from infection. Use a soft small toothbrush for mouth care. The correct answer is option D. Use a soft small toothbrush for mouth care. Question number 60. Recommended practice is to complete blood products infusion to a pediatric patient within 4 to 6 hours in order to lessen the risk of. Options are bacterial contamination, thrombus formation, febrile reaction, platelet aggregation. The correct answer is option A, bacterial contamination. Question number 61. Artificial pulse generator is indicated for the treatment of. Options are sinus tachycardia, atrial fibrillation, complete heart block, supraventricular tachycardia. The correct answer is option C, complete heart block. Question number 62. When performing cardiac compression on an adult client, it is essential to exert vertical downward pressure which depresses the lower sternum at least. Options are half to 3 by 4th inch, 3 by 4 to 1 inch, 1 to 1.5 inch, 1.5 to 2 inches. The correct answer is option D, 1.5 to 2 inches. Question number 63. Respiratory complications are common in patients with myasthenia gravis because of. Option A, narrowed airway. Option B, impaired immunity. Option C, ineffective coughing. Option D, viscosity of secretions. The correct answer is option C, ineffective coughing. Question number 64. The antidote of carbon monoxide is. Option A, ingestion atropine sulfate. Option B, vinegar. Option C, calcium gluconate. Option D, oxygen. The correct answer is option D, oxygen. Question number 65. A patient receiving spironolactone to treat hypertension. Which of the following instructions should a nurse provide? Option A. Eat foods high in potassium. Option B. Take daily potassium supplement. Option C. Discontinue sodium restriction. Option D. Avoid salt substitute. The correct answer is option D. Avoid salt substitute. Question number 66. Which of the following nursing interventions should be instituted the day after surgery for the patient who had undergone pneumonectomy? Options are provide range of motion exercise, strip chest tube every hour, force fluids to 3500 cc per day, monitor intermittent positive pressure breathing. The correct answer is option A, provide range of motion exercise. Question number 67. A nurse is removing an indwelling urinary catheter. Which of the following action is appropriate? Options A. Wear sterile gloves. B. Cut the lumen of the balloon. C. Document the time of removal. D. Position the patient in the left side. The correct answer is option C. Document the time of removal. Question number 68. A patient with myasthenia gravis is admitted to the emergency department with complaints of respiratory distress. The patient's condition worsened and he is likely to end up in. Options are metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. The correct answer is option C, respiratory acidosis. Question number 69. Furosemide is dash kind of drug. Options are A. Thiazide diuretic, B. Osmotic diuretic, C. Loop diuretic, D. Potassium sparing diuretic. The correct answer is option C. Loop diuretic. Question number 70. Which of the following vitamins is used to enhance absorption of calcium? The given options are vitamin E, vitamin D, vitamin B, vitamin A. The correct answer is vitamin D. Question number 71. In endotracheal suctioning, the nurse must always remember to. Options: give 100% oxygen before suctioning. B. Give propped up position before suctioning. C. Give Riles tube feed before suctioning. D. Insert the catheter until the cuff reflex is stimulated. The correct answer is option A. Give 100% oxygen before suctioning. Question number 72. Forceps needed for intubation is thumb forceps, Magill's forceps, artery forceps, mosquito forceps. The correct answer is option B. Magill's forceps. Question number 73. Gingival hyperplasia is a side effect associated with this anti-seizure drug. Options: valproate, phenobarbital, diazepam, phenytoin. The correct answer is option D. Phenytoin. Question number 74. Dash is a congenital acyanotic cardiac disease. Options: TOF, transposition of great artery, ASD, pulmonary atresia. The correct answer is option C. Atrial septal defect. Question number 75. Mr. K is on tab thyroxine 100 mg daily. The nurse instructs the patient to take the medicine daily. A. Along with food. B. Half an hour after food. C. On empty stomach in the morning. D. At bedtime with a glass of milk. The correct answer is C. On empty stomach in the morning. Question number 76. Choose the wrong statement related to storage and disposal of biomedical waste. Options are A. Infected plastics are collected in red container. B. Infected non-plastic items are collected in green bag. C. Cytotoxic drugs are collected in black container with a cytotoxic label. D. All general waste are incinerated. The correct answer is option B. Infected non-plastic items are collected in green bags. Question number 77. One of the common manifestation of hyperglycemia is options: tremor, anorexia, hot and dry skin, muscle cramps. The correct answer is option C. Hot and dry skin. Next question. Any disorder due to defective or faulty nutrition is called options: dystrophy, dyspepsia, dysphagia, dystonia. The correct answer is option A. Dystrophy. Question number 79. Contact precautions are essential in preventing the undermentioned diseases except option A. H1N1 influenza, B. Wound infection, C. Conjunctivitis, D. Hepatitis. The correct answer is option D. Hepatitis. Question number 80. Choose the false statement. A. Viral meningitis is transmitted by droplet infection. B. Measles is an airborne infection.